Hello, my name is Meghan Vukorpa, and I'm a PGY4 at Spectrum Health Lakeland in St. Joseph, Michigan. I will be presenting the comparison of Yale Swallow Protocol versus traditional nursing dysphagia screen in the prevention of aspiration pneumonia, a retrospective study completed with my faculty attending Dr. Matthew Hysell. The background of this study is based on dysphagia screening in our stroke population, which currently is supported by Level C evidence as published in March 2013, ASA, AHA guidelines for early management of patients with acute ischemic stroke. It is based off a study by Weinhardt et al. Named Accuracy of Dysphagia Screening, a comparison of registered nurses and speech therapists. As a resident that sits on our hospital stroke committee, I was interested in investigating how aspiration pneumonia rates were in our hospital after a change from the dysphagia screening in 2017. Our group decided to go from the traditional nursing dysphagia screen, which was subsequential administration of small amounts of clear liquid, transitioning to applesauce and a cracker as the patient tolerated. And in February of 2017, we formally switched to the Yale Swallow Protocol. The methods for this project included using the EPIC server from January of 2015 through June 2019, where we identified all patients admitted with stroke DRG codes. We then recorded baseline NIH score, results from their dysphagia screening, presence of subsequent pneumonia, and length of stay. Analysis consisted of chi-square testing, Mann-Whitney U testing, and student T testing. A total of just over 1,300 charts were obtained during this time, 624 who had undergone the traditional screening, 607 who had undergone the Yale Swallow Protocol. The average NIH for each group was comparative. The traditional group with an average NIH of 5, and the Yale group with an average NIH of 4.3. Pneumonia rates were not significantly changed between the two groups. Pneumonia rate in the traditional screen was 2.1, with the pneumonia rate in the Yale group 2.0. We did find that 150 patients had not undergone a dysphagia screen. Average NIH in this group was 10, and pneumonia rate was significantly higher at 14%. In 59 patients screened with an NIH over 6%, creating an average of 10, the pneumonia rate for that group with the dysphagia screening was 1.7. Patients with pneumonia spent an average of 9.8 days in the inpatient side of the hospital, and the high NIH group lacking pneumonia averaged 5.1 days. Again, this is just an easier way to kind of display the two groups next to each other. We have the traditional nursing screen, which has our total of 624, an average of 5, and a pneumonia rate of 2.1, versus our Yale study group with a total of 607, average NIH 4.3, and pneumonia rate 2.0. Overall, dysphagia screening subsequently reduced pneumonia rates and length of stay following stroke. However, we did not find a different significance between the traditional nursing screen and the simpler Yale Swallow Protocol.